Hi, I'm Dr. Jeff Hall, international speaker and myth-busting orthodontist. In this video, we are going to discuss how to choose an aligner system to use in your practice. The three factors that you need to consider when deciding on which aligner system to use. Many people look at cost as being a primary factor. Obviously, we're all cost sensitive, but my advice to you is to provide the best option to the patient and let them decide on the cost. You will be surprised how many patients will agree to a cost if you actually recommend it and do so with passion. We can break down aligner cases into the difficult and the moderate cases. With the difficult cases that require lots of aligners and lots of attachments, I still would recommend using Invisalign today because it's an all-inclusive cost. So whether you do 40 aligners and then have to do another 30 aligners later, it's still the one cost. Where most of the other companies are providing a cost per aligner, and if the aligners become excessive, so does your laboratory bill as well. With the most difficult cases, with large numbers of aligners, you actually have a fixed cost which you can budget for. And in fact, the most important part in your practice is your chairside time, not your laboratory bill. So you need to find a system that will provide you with that predictability and reduce your chairside time significantly without having to do lots of refinements. That's more important than the total cost that manufacturer is going to charge you. However, then we go to the moderate cases where it might be 10 or 20 aligners. And there are many companies out there on the market today, such as Smile Styler, such as Clear Correct, such as the Sure Smile aligners, just to name a few. And there are more companies coming out. And they may be really good to use for those moderate crowding cases where you might only need, say, 20 aligners. However, don't be mistaken that the setup that they will give you is going to be correct. You still have to understand the biomechanics. You still have to understand where and how to put the attachments on in the right spot. You still have to understand the staging of movements because the technicians will not give you back the proper digital setup. And if you don't get that back and you don't get it right, you will end up with a case that will take you much longer and will not treat out in the way that you expect. If you want to find out more about aligner therapy, contact us at orthoed.com.au, the most in-depth and trusted orthodontic course in Australia.